Hi. Continuing with the topic of cardiovascular system, there are certain other questions that are usually seen in scenarios which are usually asked in cardiovascular system. One is cardiac failure. How do you identify a case of cardiac failure? Cardiac failure will have some underlying cause, usually a congenital heart disease, and then they will have other features like hepatomegaly, basal crepitations, S3 gallop, tachycardia, all those features will be there. So you can identify a cardiac failure with these features. And clinically, they will have in history succus cycle as an infant, head sweating, all those things. Then you will have shock. Shock is also one condition which is frequently asked in cardiovascular system. In shock, there are different types of shock. In cardiogenic shock, there may be an underlying cardiovascular problem like a CHD with low volume circulation features suggestive of. Then hypovolemic shock, either a dehydration or a suggestive of blood loss or anything will be there with low volume pulse, tachycardia, low BP, all those things will be there in a hypovolemic shock. In another type of shock is the septic shock or a distributive shock, in which there will be a tachycardia with bounding pulses. That is more in favor of a septic shock. The fever will also be there, so because it's an infective cause. Then you can also get hypertension. Hypertension, obviously the values of blood pressure will be above 120, around 140, 80. But in pediatric it is age dependent, but when scenarios are given it will be higher value. So you can easily dictate hypertension as hypertension, and there will also be headache, blurring of vision, all these things. That is how hypertension scenarios come. Then infective endocarditis is another possibility. Infective endocarditis usually occurs in a child with already existing heart disease. So you will get a new murmur, you will get fever, splenomegaly, rash, petechial hemorrhage, all those things may be there. Prolonged fever may be there. So these are the usual conditions which are asked in the cardiovascular system. So based on these scenarios, you can reach a diagnosis, and then you can answer the relevant questions which are given. This discussion concludes the cardiovascular system. Then we will continue with other systems in the next video. Thank you.